to our Community Partner Spotlight Series. My name is Jessica Mahiran, and I am an outreach coordinator for North Idaho Pride Alliance. When the coronavirus put a hard stop on our annual Pride in the Park planning, our Rainbow Squad quickly pivoted and reimagined how to celebrate Pride Month and connect our community with valued partners and their services to ensure that even during a pandemic, there is local LGBTQ representation and resources. We decided to launch our CD for Pride campaign and create opportunities throughout Pride Month to engage and connect through multiple platforms. This vlog series is to highlight our community partners who share in the vision of unity, inclusion, and empowering others. Today, we are very excited to be talking with Hillary Hunt from Panhandle Health District, who can share with us the good work they are doing and how you can get involved. Welcome, Hillary.
Thank you very much.
Hillary, can you please tell us about Panhandle Health District and about the services and programs you offer to the greater community?
Yeah, so Panhandle Health District serves the 5 northern counties in Idaho with over 40 different public health programs. So that ranges from clinical services like family planning services, women's health, STD and HIV testing, cancer screening, immunizations, and other routine care. We also offer health education, so looking at opioid prevention, adolescent pregnancy prevention, fit and fall proof, which is a fitness program for seniors, or tobacco cessation. And then we also have, disease control, food and drinking water safety through environmental health programs, home health, WIC, diabetes prevention, or our nurse-family partnership. All of our programs in general are aimed at promoting a healthy lifestyle and preventing disease while protecting our local environment.
Great. What is your role at Panhandle Health District, and what are some examples of the specific work and projects you do there?
So I'm a health education specialist with our health promotions team, and I also work part-time with our epidemiology team. So with epidemiology, we follow up with people who are diagnosed with certain diseases to try to find out how they got infected and then try to prevent those diseases from spreading to others. In health promotions, I work on a few different programs tied to our clinical services. So I coordinate our family planning program, which emphasizes access to a range of family planning methods and services that promote optimal health outcomes for low-income individuals, including adolescents, or those who generally lack access to reproductive health services. I also coordinate our Women's Health Check program, which is Idaho's breast and cervical cancer screening program for women who are uninsured and have an income less than 200% of the federal poverty level. As a backup to Women's Health Check, we also offer vouchers for mammograms for women who are uninsured, underinsured, or who face other financial barriers for breast cancer screening. And then finally, I also coordinate our STD and HIV prevention program. So I am especially focused on syphilis, HIV, and Hep C programs to get people tested, get people treated. I really work to promote safe sex most of all, and host a lot of educational outreach within our community, such as STD education in middle schools and high schools. And I work with our clinics and epidemiology team to make sure that those who do get tested for an STD and are diagnosed with an STD or HIV get treated, as well as getting to test and treat their sex partners, needle sharing partners, or other partners in risk behaviors who need testing and treatment.
Wow, you definitely sounds like you stay busy there. Lots of great work there. What other partners in our greater community do you frequently collaborate with?
So personally, in a lot of my work, I do a lot of work with medical providers who might be screening their clients for breast and cervical cancer, doing STD testing, or just any other disease diagnosis. So with them, I try to keep them up to date on changes in screening recommendations and different management and treatment guidelines. An organization I work with quite a bit in particular is the North Idaho AIDS Coalition. So with NIAC, we contract with them to refer our clients who do test positive for HIV. So they help with their case management and getting them the resources that they need. And then we also collaborate on HIV education and awareness events, really focusing on destigmatization. And we try to work on promoting free testing events. And then I also work with Susan G. Komen and Patty's Bar and Grill are actually our two funding sources for our voucher programs for mammograms. So those are a little bit more fun, free. free programs there. And then in general, Panhandle touches a range of businesses and partners throughout the 5 northern counties, because really we're reaching out to all residents in some way or another. So whether it's working with schools to provide STD education, pregnancy prevention, or working with school nurses to discuss how the influenza season is impacting their students and staff in a given year, working with business associations to share information about the opioid epidemic or guidance to prevent the spread of COVID. And then we also partner with a variety of restaurants and other businesses just to foster a healthy environment for the people in North Idaho and host fundraising and educational activities.
Great. How has COVID-19 affected Panhandle Health District and the audience it serves? What are some of the types of things your organization has done to try to adapt to changing circumstances?
Yeah, Panhandle has been working around the clock basically since February to do a lot of different things related to COVID-19. We're providing guidance for medical providers, schools, long-term care facilities, churches, senior citizen organizations, small businesses, anyone who needs it. We coordinate testing, we can conduct investigations for those who do test positive, and we conduct contact tracing activities. Really, we're doing our best to keep North Idahoans informed of the local situation. And through that, we also started a call center a few months back for people who have questions about the virus. And if someone has symptoms and they are curious about how to get tested, we can help them with that. Normally, we do spend a lot of time with clients and community partners. And so a lot of our daily operations, just like everyone else, have been canceled or changed, moved basically completely online. So we're seeing fewer clients in our clinics. We've moved to a lot of telehealth appointments when no physical exam is necessary. Our WIC office is doing all of their appointments by phone to avoid bringing pregnant women or young infants into the office. And, just trying to adopt to new ways of meeting via Zoom, wearing masks, and just being extra vigilant about our hand hygiene, and practicing good sanitation procedures for our spaces and commonly touched surfaces. So this being my first year in this role, I was super excited to participate in Pride at the Park. I know it was a really fun activity for my predecessor. So I gotta say, well done. Adapting and finding a way to still get everyone involved. I was really excited to hear that there was a really responsible response to the situation.
Well, thank you. We are so grateful also to Panhandle Health District for just communicating to the public so often on Facebook and through the newspaper, and so that we can all try to stay informed in this very changing time. One week to the next, it can change. So thank you. How does Panhandle Health District work to promote diversity and inclusion in our greater community? What resources does your organization offer to LGBTQ people and their families?
So ultimately, I would say our message is just that we want everyone to know that we're here to help you. We are going to provide services to anyone in a respectful environment where you're not going to be judged. A big motivator for us is that we're trying to decrease health disparities. So we see that there's evidence to show that gay and bisexual men and transgender women are at higher risk of HIV and STDs, especially among people of color. Lesbian women are less likely to receive preventive services for screening. And in general, members of the LGBTQ community face stigmatization, social stress, peer victimization, and all types of stresses when it comes to accessing healthcare services. So we recognize how important it is to be able to feel comfortable and accepted in order to seek out necessary services. And this lack of appropriate training in healthcare workers and the experiences within the LGBTQ community lead to higher rates of smoking, alcohol use, drug use, and suicide compared to heterosexual counterparts. So we are really actively working to make those health disparities disappear. So we strive to provide an environment within our clinics that feels inclusive, where our staff are actively working to make you feel comfortable when you come see us for whatever reason. We'll use the name and pronoun that you prefer. We're never going to judge you for the gender of your sex partners, and we're going to do our best to make you feel welcome. And this is a task that we're working on within our clinics, but also throughout the community. when I go and speak with providers, when we're talking about guidelines, this is not a general, we're going to address root problems as well and make sure that our partners are also working to provide a respectful and inclusive environment for every client.
Great, awesome. So North Idaho Pride Alliance encourages community members to get involved and support allied organizations and businesses. Tell us about ways people can interact with Panhandle Health District, and if you have any calls to action, such as volunteer opportunities or upcoming projects to support.
So normally we would be at Pride in the Park passing out condoms, lube, sharing educational information. So I still want to push that same message today. That big one is just please practice safe sex. Get yourself tested every time you have a new partner, have symptoms, or just at your annual exam. Because the most common STD symptom is no symptom at all. And coming to get tested, we're never going to judge you for who you're having sex with or how many people you're having sex with. We just want you to do it responsibly and protect yourself. And you can stop by any Panhandle Health District office and ask our staff for condoms. You don't have to have an appointment, just walk up to the desk. But the other thing I would say is just make an appointment for STD testing to discuss PrEP options or to discuss contraceptive options. And we do host free testing events throughout the year. So, follow our Facebook page, whatever you need to do to kind of stay up to date, and we'll let you know. And finally, in this time, please wash your hands.
Yes, very good advice. Well, that concludes our Community Spotlight series. Thank you so much, Hillary, for joining in today and sharing about Panhandle Health District. Together, we can show our resiliency and how we react and create new ways of educating, networking, and advocating for LGBTQ people, allies, and community partners. Stay tuned for more community partner spotlights posted on our website at nipridealliance.com, YouTube, and Facebook pages. Until then, stay home, stay healthy, and stay proud.